Welcome to Pregnancy and Birth Diaries. Today we will be talking about newborn's first poop and why you need to know about it. Meconium passage is a newborn's first stool after birth, which is called meconium. It is thick, it's sticky, and usually greenish black in color. The interesting thing about meconium is that it's made of materials that the baby ingested while in the womb, such as amniotic fluid, skin cells, and other substances. Meconium passage usually happens within the first 24 to 48 hours after birth. It can happen during or right after birth as well, but sometimes it may take a day or two for a baby to have its first meconium bowel movement, and it's a way of clearing out substances that were present in the digestive system during pregnancy. When meconium passes inside the womb, when a baby is close to full term or at full term, then it might be linked to stress or infection between the baby and the mother. But for babies born after the due date, the reason often is the maturation of the digestive system. So why meconium passage is so important? Because it's an indicator of a working digestive system. Because the passage of meconium is kind of like a sign that the baby's digestive system is working and functioning as it should. In some cases, a delay in meconium passage could be a sign of potential issues with the baby's digestive tract, and doctors often monitor this process to make sure that everything is developing as expected. Now, what happens if meconium is passed during birth? Because babies sometimes pass meconium during the birthing process, and if this happens, it's important for doctors delivering the baby to be aware of it, because meconium in the amniotic fluid can be a problem, since it might be inhaled by the baby during delivery, and that might lead to potential respiratory issues. To be more specific, as I have mentioned, there is also a case where meconium can be passed in the womb early, and so whether during delivery or in the womb, if meconium finds itself in the amniotic fluid, it might cause meconium aspiration syndrome, MAS. But it's not common. Apparently, only 5% of babies with meconium stained amniotic fluid have MAS. So if the baby has passed meconium during birth and there is a risk of it entering the airways, the doctors will keep an eye on the baby for any signs of breathing problems or infections or other complications related to meconium passage. In short, meconium passage is a normal part of a newborn's early days, showing that the digestive system is working as expected. But if meconium is passed during birth or while it's still in the womb, then it might require attention to prevent potential respiratory issues. So please talk to your doctor if you have any questions or concerns regarding this issue. All right, that is it for today. Stay well, and I will see you